Greetings, everyone. On behalf of the Shelter of Light family, I would like to extend my sincerest gratitude to all of you for being here with us today. I'm Enzo Bautista, your host for this webinar. Enlighten, the Sol webinar series, is a huge feat for the independent rescue. We hope that this endeavor will help more people in becoming educated in relevant and important topics on pet care and animal welfare. Given that, let us start our first episode. Today, we will focus on the topic traversing the maze of feline infectious peritonitis, or FIP. While definitely familiar to many animal lovers out there, FIP is still shrouded in mystery. FIP is one of the most complicated diseases that can affect cats. Without treatment, it could quickly and easily lead to death. Today, we'll be hearing from two speakers with heaps of knowledge and experience to help us understand this illness and hopefully give the proper care if our cats ever need it. To begin, let us welcome our first speaker for today's discussion, Dr. Karlos Martinez. Dr. Karlos Martinez is a veterinarian at the Cat Clinic, the first feline-focused vet clinic here in the Philippines. He is a strong advocate and pioneer of FIP treatment in the country. Dr. Martinez has assisted numerous cat owners in successfully treating their feline companions, and his expertise in this field is unmatched. He will be helping us understand the topic from a vet's perspective, shedding light on the latest developments in FIP treatment.
Hello everyone, I'm Dr. Karlos Miguel C. Martinez. I'm a veterinarian in the Cat Clinic. So for today, I'll be discussing feline infectious peritonitis for everyone. And first, I'd like to thank you, Shelter of Light, for inviting me for this webinar to share awareness for our cat parents out there, para malaman nila ano po ba talaga ang FIP, what causes FIP, the signs and symptoms of a cat with FIP, and the things that we should prevent for your cat to don't have this disease. So our topic for today is the traversing the maze of feline infectious peritonitis. I'll be discussing first what is FIP. Okay, so many of us don't know what really is. What is the FIP? So feline infectious peritonitis is caused by an infection with a virus known as feline coronavirus. Meaning to say, FIP is a virus. Okay, so first, ano po ba ang feline coronavirus? Feline coronaviruses are a common group of virus that often infects the upper respiratory tract or gastrointestinal tract in different animals. It means coronavirus po is very common sa mga pets po natin, even us in humans. Okay? So it's a common virus. What happens is that feline coronavirus mutates inside the body of a cat and it turns into FIP. So basically, FIP is a mutation from feline enteric coronavirus. Okay? So, in explanation po, the FCOV, or it's like the baby virus or the common virus, infects a cat. And inside the body of the cat, nag-mutate po yung FCOV into FIP. Okay? So, ibig sabihin, kailangan po ng FCOV ang katawan ng pusa para mag-mutate po sa FIP. Okay? So for the transmission, the mode of transmission of FCOV is primarily fecal-oral route. Okay? Meaning to say, kapag po nadidilaan, natitikman ng pusa ang pupu or body secretions ng ibang pusa na infected with FCOV, doon po siya mahahawa. As I said earlier, cat-to-cat transmission of FIP is not a concern. Why? Because as I said, kailangan ng FCOV ang katawan ng pusa para maging FIP. So meaning to say, hindi po na-shed ang FIP sa feces. So FIP is not contagious. Okay? Ito po ang isa sa pinaka-common questions na I always encounter kung nakakahawa po ba ang FIP. So, I will clearly say to everyone, FIP is not contagious. What is contagious po is yung FCOV. Okay? Yung pinagmulan po ng virus. In this table po, parang sinummarize ko or the main difference of these two viruses. So, feline enteric coronavirus versus FIP or the Feline Infectious Peritonitis. So meaning to say, FECV is very infectious or very contagious, while FIP is not infectious or not contagious. For the signs and symptoms, the FECV causes mild diarrhea, vomiting, respiratory signs, and usually self-limiting. Ibig sabihin ng self-limiting, with or without treatment, our cats can recover from this virus or from this disease. While FIP has so much symptoms, it's very extensive. And later on, i-discuss ko po every symptom ng forms ng ating FIP. So what are the risk factors leading to FIP? So ano po ba yung possible causes or mga points to consider bakit po ba nagkakaroon po ng FIP ang alaga po natin? Okay, number 1, cats below 2 years old. So, yung mga junior age cats. And FIP is predisposed in male and sexually intact cats. Overcrowding. Kaya unfortunately, very common po ito sa mga may shelter or mga rescue houses na marami pong pusa inside. And another one is due to stressful condition like recent vaccination, surgeries, moving homes, and stressful environment. So these things ay nakakapag-trigger po ng pag-mutate ng FCOV into FIP. So ito po yung mga things na pwede nating iwasan para hindi po mangyari yon. And any factor leading to increased gastrointestinal replication of FCOV increases the risk for the mutation to occur and subsequent development of FIP. So ibig sabihin, kapag nagkasakit ang alaga natin and hindi po natin siya nagagamot right away, may mga other viruses pa na ongoing like parvovirus, like the parasite, the giardia, it causes the immune system of the cat to get lower and lower. And nagkakaroon po ng opportunity yung FCOV na magkaroon po ng maraming viral load. And therefore, yung FCOV po inside sa katawan or sa tiyan ng pusa, doon po siya nagkakaroon ng chance na mag-mutate into FIP. Okay? And the virus can remain dormant or inactive in the body for months to years. So, kailangan isipin natin na ang virus po is pwedeng matulog inside the body ng cat. Kaya dapat lahat po ng signs and symptoms na mararanasan po ng ating mga alaga, always na-observe natin and always ask sa help ng ating mga professionals or veterinarians kapag nagkaroon po sila ng signs para maagapan po natin. Okay? So those are the things na we need to consider para malaman natin bakit ba nagkakaroon ng mutation ang FCOV into FIP. Okay, so next one, I'll be discussing the clinical signs of FIP. So for the clinical signs, so most of the parents or the cat parents, ito po yung alam po nila, the wet form and the dry form. So basically, pag wet form, usually ito po yung may water or fluid in the abdomen. And sa dry form naman po, ito po yung nagiging emaciated or pumapayat po yung cats with FIP. But these classifications represent different stages or manifestations of the same disease. Meaning to say, hindi po porket wet form lang po yung alaga natin, pwedeng wet form lang po yung magiging clinical signs po niya. Wet form can turn into dry form, and subsequently dry form can actually be a wet form then in the future. And usually, we also have this ocular form and neurological form, which are common for dry form FIP. Okay? So, didiscuss na natin or expound natin one by one each form po. So, for FIP general symptoms or both forms po or lahat ng forms, these are the common symptoms. Yung cat po is merong low immune system. Ibig sabihin, palaging nagkakasakit, hindi normal ang kanyang immune system compared to other cats. Lack of appetite or walang ganang kumain. Lethargy, lack of energy or palaging natutulog, walang energy or nag-iba po ng behavior. Persistent and fluctuating fever is a very good point to consider when diagnosing FIP. Infection not responding to antibiotics. So kapag na-try na almost lahat ng antibiotics tapos hindi pa rin gumagaling po yung infection, this is a good point to consider for FIP. Weight loss, so yung talagang pagbagsak po ng body weight ng cat. And lastly is jaundice po, or yellowing of mucous membranes and skin. So as you can see, there's a cat in here, yung nasa baba is meron po siyang color yellow na ears. So usually yan po yung tinatawag nating jaundice, icterus, or kung baga sa tao yung parang yung same symptoms ng hepatitis po, yung naninilaw, yung mucous membranes, yung eyes, yung gums. Okay? For the types of FIP, as I mentioned earlier, we have the wet form and the dry form. First, for the wet form, the fluid accumulates because infection with FIP causes damage and inflammation of blood vessels, which results in fluid leaking from blood into the abdomen. So, tinatanong always ng mga parents or cat parents why nagkakaroon ng water dun sa tiyan. Because yung FIP po ay sinisira po niya yung blood vessels doon po sa gastrointestinal tract. Pag nasira po niya yung blood vessels, yung fluid ay magli-leak inside the abdomen. That's why, kung makikita nyo po dito sa presentation natin, meron pong cat na may bilog na tiyan. Or yan po yung water inside the belly. And here naman sa side niya is yung x-ray result ng cat with ascites or fluid in the tiyan po. So as you can see, di ko na nakikita yung organs inside dito sa x-ray niya dahil punong-puno na ng fluids. Sa x-ray po, ang fluids ay color white or parang white or cloud, and ang air ay color black. So as you can see, yung buong tiyan po niya is color white na. So ibig sabihin, pag color white na lahat, it means so much fluid inside na. Next one, for the dry form, it involves the formulation of granulomas. So ano po ba yung granuloma? Ito po yung masses of virus and inflammatory cells. Ito po yung parang nagkakaroon po ng bilog-bilog sa ating mga organs at naapektuhan po. And the signs will vary according to the organ affected. Kaya usually, ang dry form, subsequently, meron din po itong ocular form and neurological form. Meaning to say, the granulomas pwedeng umakyat papunta sa eyes, and it can traverse papunta sa brain, which is nagpe-penetrate dun sa blood-brain barrier. That's why pag napunta na siya sa brain, magkakaroon po siya ng neurological signs like paralysis and such. So, di-discuss natin later on. So, for wet form clinical signs, we have these 4 common signs. First one, as I mentioned, is the abdominal effusion or fluid accumulation in the abdomen. Pero akala ng lahat, dito lang po ang symptoms ng wet form, but no, pwede pa po siyang mapunta sa iba't ibang lugar or sa iba't ibang organs in the body. We also have the pleural effusion or fluid accumulation in the lungs. So ito po yun, yung nasa upper right area, kung saan ito po yung x-ray ng cat with pleural effusion. As I mentioned po, ang color ng water ay white, ang color ng air ay black. So ang lungs, air po ang pinaprocess niya, it should be black. But dito po sa x-ray, as you can see, almost all ng lungs po niya ay color white na. Ibig sabihin, meron po tayong fluids na ongoing sa lungs po ng ating patient. Okay? Next one is pericardial effusion. Meaning to say, there's a fluid accumulation in the heart. And isa po ito sa form ng FIP na very difficult to treat dahil heart na po ang kasama. So hindi lang tiyan, hindi lang lungs, pero pati ang heart pwede pong magkaroon ng fluids. So kaya simultaneously, kahit meron po tayong treatment with FIP, kailangan pa rin natin ng other treatments to improve po yung function ng heart and subsequently mawala po yung fluids sa kanyang heart po. And sometimes, meron din po tayong scrotal swelling or yung balls or yung scrotum po ng cat eye na mamaga. Let's now go to typical signs ng dry form. Okay, so usually it has neurological signs like incoordination, wobbly gait, and seizures. Ocular signs like discolored eyes, blurry eyes, and sometimes less commonly non-pruritic papules or nodules in the skin or parang nagkakaroon po ng rashes. And very distinct ang weight loss. Kapag ang alaga natin ay talagang distinct na ang pagpayat or pag-drop ng body weight, we should consult our veterinarians right away. Okay, so I'll be discussing the ocular neurological forms. So next slide will be the ocular form, kung saan yung eyes ang tinatopic po natin. So it is usually a form of dry FIP, but hindi po siya doon nakalimit. Sometimes wet forms can also have this ocular form. Common lang po siya with the dry form. So it has multiple lesions na involved, and usually meron po tayong uveitis. So what is uveitis? This is the inflammation inside the eye. And mag-show po ako ng some pictures na common lesions na meron ang cat with ocular form. First one is the ocular hyphema or bleeding inside the eyeball. So as you can see, meron po tayong eye here and then merong color red or blood na parang nandun sa mata. Next one, yung nasa middle picture is the rubiosis iridis or blood vessel proliferation along the surface of the iris. Parang nagkakaroon po ng mga veins na dapat hindi naman po very distinct sa eyeball. Next one is the hypopyon or accumulation of white blood cells that form a whitish layer of fluid in the lower portion of the eye's anterior chamber. So parang may cloud doon po sa baba ng mata. Even not sa baba, kahit sa ang areas din sa mata, yung parang may cloudy or parang malabo yung mata. So next one is the keratic precipitates or cellular deposits on the corneal epithelium. It's like parang meron po tayong dot-dot or yung mga batik-batik po inside the eye. So pag may nakikita pong ganyan sa ating mga cats, consult the veterinarian agad right away kasi marami pang possible reasons. Anisocoria is a condition in which the pupils of the cat's eye are different in sizes. So, usually kapag yung magkaiba po yung pupil size, yung isa normal in size and yung isa maliit naman po, anisocoria ang tawag. Sometimes, this is parang unang signs ng ocular FIP. And dyschordia, an abnormality in the shape of the pupil of the eye or iba po ang shape ng pupil. Okay? And synecia or synechia are adhesions between the iris and other structures in the eye. Kapag tiningnan po ang mata ng ating mga alaga, parang yung structures po sa eye niya is magkakadikit na. I've seen patients na meron pong ganitong signs with ocular form po. And sometimes we also have retinal damages like retinal hemorrhages, retinal detachment, and perivascular exudates, and inflammation of the optic nerve. Okay, so next po, let's now go to the neurological form. So for neurological form, we have this lethargy or weakness, seizures, paralysis, head tilting, nystagmus, or ito po yung involuntary movement of the eye, and behavioral changes and incontinence. So usually, ano po yung sign na mayroon po tayong neurological form? I always ask my clients po or the patients kung nakikita po ba nila yung cat nila na parang lasing or like drunk po maglakad. Usually, ito po yung isang pinaka-common symptoms is yung parang lasing or drunk maglakad yung cat. Possible po nito or mataas yung chance na nagde-develop na siya ng neurological form na FIP. Okay? So, those are the most common signs and symptoms na meron po ang different forms ng FIP. Once makita na po ng ating veterinarians those signs and symptoms, we will now go to the pinaka-star of our diagnosis or yung pagkuha ng blood sample and laboratory testing para ma-identify kung meron po bang FIP ang alaga po natin. So for the diagnosis, we usually require, or actually it's a 100% recommendation or requirement before po tayo mag-diagnose ng FIP is to have a complete blood profile or the CBC and Chem. Okay? So first one, doon po tayo sa CBC or the complete blood count or the hematology report. Sometimes in FIP, it can be normal. Sometimes it can have alterations with the white blood cell, it can be elevated or low, and anemia is very persistent po in diagnosing FIP. Okay? So next one for blood chem or biochemistry. These are the key points to consider para po malaman natin or diagnose po natin ang cat with FIP. So first one, we have high globulins or proteins inside the body ay nag-elevate po talaga, and low albumin. Okay? So kapag itong dalawa na to ay nakita po right away, it's a very good consideration for FIP diagnosis. Sometimes it can cause alteration with liver and kidney values. So pwedeng ang liver or kidney values, like for liver, yung ALT and ALAP, and the kidney, the creatinine and BUN can go high. Kasi as I said, organs are affected with FIP. And this is the most important, or one of the most important things to consider is the albumin and globulin ratio. The AG ratio is usually low, and this parameter can be useful to evaluate how likely FIP is in an individual case. It also has been suggested that an AG ratio of less than 0.4 makes FIP very likely, while an AG ratio of 0.8 or more than 0.8 makes FIP very unlikely. Okay, so usually kapag may na-diagnose po tayong patients, ito po yung isang key points na kino-consider po natin. Kapag na-present na natin lahat yung signs and symptoms, yung history ng cat, and meron na rin po itong result. And kapag nakita natin less than 0.4, mataas po yung chance na pwede na tayo mag-proceed with the treatment right away. Okay? And next one is the high bilirubin, or ito po yung cause ng pagkakaroon ng jaundice or nagpagkakaroon ng yellowing ng mucous membranes sa ating cats with FIP. Other tests like rapid test kits or a positive test that indicates that the cat has been infected with FCOV and has seroconverted to FIP. Sometimes, yung mga rapid test kit po natin, it can also help with our diagnosis. Kasi syempre, maganda pa rin na rule out everything. Or kailangan simultaneously while nasa treatment tayo with FIP, tinitreat din natin yung mga underlying or yung mga comorbidities po ng cat. And isa pong question, and always ko nakikita sa social media, na some pet parents, unfortunately, na nag-positive lang with FCOV, yung cat po nila, is already seeking for FIP treatment. That's not true. So, not all FCOV positives ay kailangan na po undergo ng FIP treatment. Okay? So, remember, FIP is a mutation from FCOV. Hanggat wala po tayong katunayan na FCOV ay nag-mutate na into FIP, we don't have to proceed with the treatment. Okay? And not necessarily, for example, nag-negative po siya for FCOV, ay hindi na po siya FIP. As I said, the FCOV can already be mutated na into FIP. Okay, sometimes FIP patient ay also positive with FCOV. Sometimes FIP patient is already negative na with FCOV. Okay, so always remember that points to consider para aware po tayo with the diagnosis. And some diagnosis pa will be urinalysis, ultrasonography, X-rays, and sometimes PCR. So this one, ito po is medyo familiar na our cat parents with this one, or the Rivaltas test. This is a test for FIP wet form because this is the analysis of any effusion sample in a suspected case of FIP. This is a very extremely helpful for diagnosis, so obtaining samples of effusion should always be a priority. So ano po ba yung way ng pag-test sa Rivalta. So, ang ginagawa po here is kumukuha po ng fluid from the abdomen or from the thorax ng cat with FIP. And ang ginagawa po dito ay meron po tayong solution and yung sample na kinuha po natin from the patient ay pinapatak or drop po natin dun sa solution. And ang nangyayari, if this is a positive result, nagkakaroon po, as you can see dun sa writer picture, yung merong parang straight line forming from the surface hanggang pababa. It's like a very sticky solution na hindi po siya kumalat. Okay? Nagstay po siya yung form niya from the surface hanggang pababa. So this test actually tests if the fluid is an exudate. Okay, so we have two kinds of fluids kasi in the body. We have the transudate and the exudate. What's the difference between these two? Transudate is a clear and usually a clean fluid po from the body. And the exudate, ito naman po is yung proteinaceous or a high protein fluid inside the body. And most commonly, FIP patients na merong wet form type, ang fluid type po nila ay exudate. Okay? Kaya very important na magawa po natin ang Rivalta test para ma-consider po natin na yung fluid na yon ay exudate. So we will now go to na possible, mataas ang chance na wet form FIP, yung meron na sakit yung pusa. So I'll be showing po, so medyo gross lang po yung picture. Okay, ito po yung mga organs na usually affected with FIP. Almost all organs in the body ay naapektuhan po ng sakit na ito. From the kidneys, to the liver, to the spleen, to the intestines, lungs, heart, eyes, and to the brain. So nagkakaroon po ng mga granuloma, yung nabanggit ko po kaninang mga masses ng mga inflammatory cells and virus. So inaapektuhan po niya lahat ng organs in the body. Kaya this is a considered na multi-systemic disease or a very extensive disease. So kaya very important na as early as possible, ma-detect na po natin na ang cat ay may FIP before it's too late. Okay, so next slide. So next slide po is a summarization lang ng mga signs and symptoms ng cat. So I got this from FIP Warriors UK po. So I will not mention na everything dito sa slide na to, but very very nice po na meron po tayong ganito para malaman natin sa bawat system ng cat, ito po yung usual signs and symptoms na naranasan po ng cat with FIP. So without treatment, unfortunately, FIP is a serious disease with near 100% mortality. So we need to take seriously this disease dahil without treatment, almost wala pong nakakasurvive with FIP, unfortunately. FIP is incurable before. So before po ma-invent or before ma-formulate po ang treatment with FIP, hindi po gumagaling ang mga pusa na nagkakaroon ng sakit na ito. So ang ginagawa lang po before are only supportive care and management ng symptoms like antibiotics, nutritional care, organ supplementations, hospitalization. Our only goal is to improve the quality of life and prolong yung patient's survival time. Okay? So before, this disease is a very serious disease na talagang lahat ng cat na nagkakaroon ay hindi po nakakasurvive. But we are very thankful and sobrang thank you with the one na nasa likod ng pag-invent po ng treatment with FIP, which is ito na po yung sa next slide po natin. Okay, so we have this treatment, what we call the GS441524. This is invented by Dr. Niels Petersen and his team. Okay, so next slide. So what is GS? So GS actually very familiar na po yung mga cat parents na nag-undergo ng treatment nito. So GS is a short for GS441524, which is an experimental antiviral drug or nucleoside analog. that has cured cats with FIP in field trials conducted at UC Davis by Dr. Niels Pedersen and his team. Okay, so meaning to say, GS po is an experimental antiviral drug. So ibig sabihin, unfortunately, wala pa ito sa ating market or nasa black market pa po siya. Okay, kaya very difficult pa rin tayo makakuha ng treatment, and most of the cat parents are saying why medyo mahal na treatment kasi nga po medyo mahirap pa makakuha ng gamot dahil nasa black market pa. Okay? So ano po ba yung ginagawa or basics na ginagawa ng GS inside the body? So this is a nucleoside analog. So meaning to say, ang main function po ng GS or usually ginagawa ng GS sa body ng cat is ini-stop po niya yung replication ng virus doon sa body ng cat. Once na magkaroon na ng action yung GS sa body ng cat, na stop na po ang replication, yung own immune system ng cat will act and eventually eradicate na po yung virus. That's why we need to continuously give the medication, and yung napag-aralan po na 84 days na treatment ay kailangan ay strictly followed. Okay? So, ibig po sabihin, we need to strictly follow the GS protocol. We need to follow po yung protocol na in-invent ni Dr. Niels Pedersen and his team. No other protocols na kailangan nating sundin, only the 84 days, once a day injection, and sometimes meron na rin po tayong oral medication, but kailangan natin i-risk assess yung patient before po mag-undergo ng oral medication. And some pet parents are asking me if, Doc, pwede na po bang i-shift sa oral medicine? So, I preferred as always would be yung injection. Kasi yung subcutaneous injection talagang readily absorbed by the body. Walang nasasayang, walang natatapon, wala ring naapektuhan ng mga gastric acids po sa tiyan. Kasi injected siya through the skin, absorbed through the body. But sometimes, kapag po ang patient ay stable na, normal na po lahat, and wala namang problem, and sometimes may anxiety or mayroong skin hypersensitivity or skin disease yung cat, we also consider din po yung oral medication. But medyo mahal po siya. Halos doble or triple po ng price po ng injection. So unfortunately, yung oral medication are for pet parents lang na medyo may budget for the treatment. Okay? So those are the things na kailangan nating i-remember. What is FIP? Kung ano po bang FIP? What are the common signs and symptoms ng FIP? We need to familiarize. What are the results or yung mga results na ma-find out natin after ng test? We need to remember and be familiarized with that. And the treatment po ng FIP, na we should always follow yung treatment protocol. Wala nang iba, we should follow the treatment protocol by Dr. Niels Pedersen. Okay, so before I end my discussion, I'd like to show some of my FIP graduates po for the past years in my vet practice. So I'll be showing some of my FIP graduates. I'd like to give back to them because yung quick background ko lang why I am here or why I am speaking in front of you guys, because yung sinasabi ko lang to usually with my clients, because before nung baby vet pa lang ako or nung bagong graduate pa lang ako sa school, meron po akong cat, or he's my first cat, and unfortunately he suffered from a disease like diarrhea, not responding to antibiotics. So I thought it's just a simple virus or it's a parvovirus, but I already did all the treatment for parvo and all, pero hindi po siya nagre-respond hanggang sa lumabas yung symptoms na nagkaroon ng yellowing yung ears niya, nagkaroon ng red po yung mata niya, or yung parang ocular form na tinatawag. And therefore, na-realize ko that my cat suffered from FIP. And that time, I advocated myself na i-dedicate ko po yung research and yung time ko for my cat, na even though hindi ko po siya na-save from that disease or from this disease, I will give back to other cats for him. So seeing these patients or seeing these cats na gumaling from this disease, mas gumagaan po yung pakiramdam ko. And I always tell my clients na we're on the same side. You don't have to worry. Marami po tayo, and always remember na there's always light po, even though sa mga darkest times na meron po tayo. Okay, so let's start off with my FIP graduation yearbook actually. So just be saying their name. So this is Nacho, and this is Sola, this is Loki. So as you can see, marami pong forms po ang meron po sila. Nandiyan po si Lolot, si Leon, Bini, we have Pizza, Pepper, and Alaska, and Monty, Kaini, and Jungkook, Tracy. We have Rhaegar, Tiger, Louis, Raya, Pochi, Toothless, Brienne, Destiny, Shati, Benji, Queenie, and Jego, and Willow, Moana, Katsu, and Blue. May mga hindi po ako nalagay with this one, so sorry, hindi ko na mahanap yung pictures, but marami pa po sila. Sobrang refreshing and sobrang masarap sa pakiramdam na yung mga pet parents na makakanood po nitong webinar na may pag-asa po. Okay, so these patients are patunay na kapag sinunod natin ang payo ng ating mga veterinarian, kapag sumunod po tayo sa protocol na ginawa po ng ni Dr. Niels Pedersen sa treatment ng FIP, and along with the help ng ating mga volunteers like from the FIP warriors like sila Miss Kelly and the admins po, may pag-asa and our cats can be treated with this disease. Okay? And lastly, the key points to consider. So FIP is one of the most challenging diagnoses for your veterinarian to make. So please bear with your veterinarians and don't get frustrated sa kanila kung hindi po nila agad ma-pinpoint kung ano po ba talaga yung sakit ng alaga natin. So as my discussion po, marami pong signs and symptoms, maraming pagdadaanan, and maraming mga things na kailangan natin i-consider. So if not, maaari naman po tayong magkaroon ng second opinion to other veterinarians. In that way, mas mabubuo po natin ang diagnosis po. Next is early diagnosis is crucial for successful FIP treatment. Okay, so as I mentioned, lahat ng organs na apektuhan ng FIP, so kapag as early as possible, makapag-start na ng treatment, yung mga organs po is hindi na maapektuhan or hindi kakalat inside the body. Strictly following FIP treatment protocols, as I mentioned, kasi unfortunately, meron na po tayong mga relapse cases dahil unfortunately hindi po na-follow ang FIP treatment protocol. So we should always follow the treatment protocol for successful recovery. And lastly, avoid stress and maintain good hygiene and preventive healthcare for all cats. So in that way, mape-prevent po natin ang pag-mutate ng FCOV into FIP. Okay? So next slide will be my references. And thank you so much everyone for listening, and I hope nakapagbigay po ako ng awareness and a guide para sa ating pet parents out there para mas maging familiarized po sila with FIP. Nang sa ganun, mas marami po tayong patients na maligtas at marami pa pong pet parents na matulungan. So I'm Dr. Karlos Martinez, and thank you everyone for listening.
Thank you very, very much po, Dr. Martinez, for that enlightening and very, very comprehensive lecture, no? You're doing your cat proud po, I'm sure. Now naman po, we'd like to call on our second speaker for today, Ms. Kelly Lim. So Ms. Kelly Lim is a teacher by profession and a seasoned fur parent of FIP survivors. She has helped numerous pet owners with their own FIP patients, including us. So Ms. Kelly Lim will share her knowledge and experiences and help us understand what to expect when dealing with such cases.
Hi, Doc Carlos. All right. Hi, my name is Kelly. I'm a FIP fur parent. I've had 2 FIP cats before. I'm also one of the volunteer admins for FIP Warrior, FIP Warriors Philippines. So we're a subgroup. So I just want to share my experiences on FIP as a fur parent. So as you can see here, these are my 2 babies. So that's Kui and Daisy. Kui is the one on the left, the tabby. So she had wet FIP before. This is what Doc Carlos mentioned a while ago. Nagkatubig si Kui sa tiyan. And during that time, we didn't really know what was going on. Um, so we had her diagnosed, and we were also, this was in 2020, by the way. This was in 2020. So during that time, GS was not being used pa in the Philippines. So we were told na it was fatal. So yun lang, we got diagnosed. We were told it was fatal, that we should just, give care na lang until the cat's time has come. So yun yung nabigay sa amin. She was 1 year old at that time. So see, when Kui was being diagnosed, she's my first cat as well. First cat ko na nga, and then first FIP cat pa. To be honest, we didn't really know what to do. So I actually did research, and that's when I found the FIP Warriors. I'll be discussing that in a bit. Sila actually super laki na naging tulong nila sa amin. And as you can see, Kui is still here with us now. She's already 4 years old. And okay, so right naman, this is Daisy. The other one, the torty is Daisy. So siya naman, she had dry ocular FIP. She was diagnosed at 4 months old naman. Now, here, I have pictures of Daisy's treatment. Si Kui wala, because I did not, I was in a very panicky mode at that time. I was not in the right mind to actually document her, what do you call this? To document her treatment. But anyway, this is Daisy. So as you can see, she's still a kitten at this time. Ito po yung sinasabi ni Doc Carl kanina na uveitis. So as you can see, from day 0 to week 2, her eye. Si Daisy kasi is one eye lang yung lumabas, and then weeks 3 to 6, as you can see, it's starting to fade. Her eye has already started opening, so medyo normal na yung itsura, hindi na yung maliit. But the cloudiness, it's still there. Okay, and then here, week 10 to 12, as you can see, it's still there, pero medyo nawawala na. We're talking about the week 10 to 12, we're talking about the treatment duration. Nasa stages of the treatment. Okay, and then here, we have the graduation photo. So you might see na may day 105 dyan. This was because we extended 3 weeks actually of the treatment, but this was Daisy's graduation photo. And then the last, of course, this is after observation period. So after the treatment, kasi we have what we're calling observation period, which is another 3 months, pero no more medicines. This is literally observation, like observation. You do nothing but observe the cat. Once the observation period is passed, that means most likely wala nang relapse na mangyayari because you've given 3 months. Meron kang 3 months na lumagpas without GS. So if any the logic there is if there is relapse that is going to occur, it should happen na during that period. So if ever nalagpasan yung period without medicine, without anything, there's no relapse, then your cat is cured. So iba pa po yung graduation from observation. The graduation is you're finished with the treatment, but observation period is also very important. Okay, kailangan pa po to check up just to make sure that your cat is doing fine. Okay, so I'll just discuss very briefly kasi I'm really very grateful for FIP Warriors. So FIP Warriors actually is a worldwide non-profit organization dedicated to helping the FIP cat parent. So our main group is actually called FIP Warriors 5.0. Nasa US to, pero there's a lot of subgroups all over the world because like it would be easier kasi if the person that's helping you is also a local as compared to, let's say, your assistance is coming from the US. You have different medicines, you have different available technology. So as far as I'm concerned, we have different FIP warriors na different US states. We have Canada, we have Singapore, and we also have Philippines. So Actually, the FIP Warriors Philippines started as a chat group. We were a bunch of FIP parents that we were just, trading notes. We were just talking and helping each other out, trading notes, different brands that we're using and stuff. And then eventually, we decided to open up na lang. We decided to make up a group page to help also FIP parents in the Philippines. So all admins actually in the FIP Warriors are FIP parents also who have decided to stay on and volunteer. Okay, so we actually guide with treatment protocol, sharing our experience, but as Doc Carl has mentioned, GS is still experimental. It's still considered a gray market drug or a black market drug. So we also try to serve like as a watchdog group kasi we've had experiences where, parents have been scammed online, or, nagkaroon sila ng problems and nobody was there to help them out. So parang ganun na rin nangyari. So that's what we're trying to do for this group. Few facts about GS. The GS actually in GS 441524 stands for Gilead Sciences. So this is a US pharmaceutical company. Sila po yung may-ari ng patent for GS, which means actually that all existing GS right at this moment are still experimental drugs. So unless na mag-release si Gilead Science ng actual GS nila, there is no such thing as an official GS drug as of the moment. I have a lot of fur parents who are also asking me, because we posted articles on the website, on the group page. Na GS is actually the basis for the remdesivir drug, which I'm sure a lot of people are familiar with because this was used for COVID. Well, yes, it is. It is actually the basis for the remdesivir drug, and of course that would bring the question, is it interchangeable? Can we use remdesivir instead of GS 441524? Technically you can, but the protocols are different from GS. So kumbaga the dosages are different. Iba na siya. Kumbaga it's not like, okay, I'm just gonna interchange, like GS with remdesivir. So a lot of fur parents actually are also complaining ang hirap mag-injection, and yeah, I would agree. As a fur parent, I would also agree with that. Mahirap talaga mag-injection because no cat will willingly get injected. And some cats are actually super drama queens. They're very vocal. I have two right here. While we're injecting, you think they're getting massacred, as in talagang iyak kong iyak. But here are some injection tips to make it easier. Make sure that you inject every day as close to the same time as possible or within the hour. This is very important. This is super important. Protocols, actually, maraming protocols on GS, but so it's really very, very overwhelming. I mean, if you are a first-time FIP parent and you don't know what to do, and then all of a sudden there's a lot of protocols right there that you have to remember, it can be a bit overwhelming, but it's going to be worth it. Please, pakisundan lang. This is very important. So make sure you inject every day as close to the same time as possible or within the hour. So the best thing to do is you should find a time of day when it's very convenient for you to inject. So let's say every night, or every morning. What we recommend for syringes is 3 ml. This would depend actually parent to parent kasi we also have parents who are very sanay mag-inject. So 3 ml lang for first timers because it's bigger, no, the syringe, so it's easier to hold and inject. As for the needle gauge, we always say 21 to 23. 23 actually is the default, 22 to 23. But some fur parents are saying na mahirap bumili ng needles availability. You want to stick to 21 to 23 talaga because, okay, depending on the cat size. Let's say 23 is the best actually. For the bigger cats na mas makapal yung subcutaneous skin, you can get away with 22 maybe. And in cases of emergency na talagang walang mabili, 21 would do. But you want to make sure that you inject slowly. Okay, the thing about the needle gauge is GS is oil-based, so it's medyo malapot. So if you use a needle na medyo manipis, it might be harder for you to inject. And you really should not force inject GS into the cat. You should It's best to inject slowly. Some parents kasi they would say, my cat is struggling, kaya minamadali yung pag-inject. Please do not do this. It would hurt the cat more actually. It would actually be better if, let's say, you're injecting 1 ml, tapos half lang yun na-inject mo, natanggal yung needle, or sobrang nag-struggle yung cat. It would be better that rather madaliin mo, you can withdraw the needle and then do a second injection na lang, like half-half. Kasi please remember that it's actually not, I mean, done correctly, it's actually not the piercing of the needle that would hurt the cat. It's actually more of when they're may reaction, yes, but then when they're reacting, it's more of kasi the GS, they feel the GS flowing through their body. So you might see like the cat would lick their skin or after you inject. So itong GS burns, GS is also acidic, very acidic actually. There are a lot of fur parents na napapansin nila, oh, may parang maliliit na sugat sa skin. Now these are this is the effect kasi like I said, it's acidic. If it gets on the skin and stays there for too long, it might actually burn the skin. So yon, what you want to do is to wash the injection area. Don't do this immediately though. I would not touch a spot or an area that's been freshly injected. So don't do this immediately. Wait mga 15 to 20 minutes or an hour even. Check kapag nagkaroon ng leaks or wala. And then kapag wala, you can wash it with either, soap and water or the baby wipes, yung alcohol-free baby wipes. So yeah. Some fur parents, especially for long-haired cats, shaving off the fur is an option. Please do consider this. It's just the fur would grow back anyway. It would make it so much easier for you. If the part, let's say sa likod, let's say mostly kasi we're injecting at the back. So if the fur is shaved off, it would be actually easier kasi makikita mo agad if there's leaks or if there are any, like burns or lumps or whatever. All right. Oh, and I forgot, most especially and most important is to distract. And when I say distract, this is like while you're injecting, you can give your cat like their favorite treat, or some people actually when I was treating kasi I would actually sing to my cat kasi tumatahimik siya at that time. Or I'd put on a YouTube video. So I have my phone. I'd put in the YouTube video because my cat's like the bird video. So parang nadi-distract sila while they're watching the birds. So and yun na nga. Anything to help our cats. So while they're watching the bird video, may taga-subo ng chow sa kanila. So no, not much complaints there. Not much complaints naman so far. So yun, these are some injection tips. Okay. Treatment reminders for parents. Weigh your cat once a week to adjust dose properly. This is very, very important. Kasi as Doc Carl mentioned, your cat, one of the symptoms talaga for FIP is your cat will lose weight. Now, as you're treating, bumabalik yung weight niya. Mapapansin mo rin like yung the body might look parang bagsak yung katawan. It would actually go back. So your cat will regain muscles, basically regain weight, and you want to weigh your cat once or twice a week so that you're making sure that the dose is being adjusted properly para hindi siya ma-underdose. This is very, very important. Symptoms must be addressed, so that Doc Carl has already mentioned this. This is very important because I have a lot of fur parents who are saying na, ay, pwede bang home remedy na lang? Please don't. Not with FIP. Please work with your vet. This is very important. Okay, so these symptoms usually are like anemia or yun nga, jaundice. And whatever symptoms that you see talaga, you have to work with your vet. This may mean survival for your cat. So please, 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 it's very important to work with your vet. Keep a record of your cat's progress. So for wet FIP cats, measure the belly and keep a record. Kasi one of the symptoms is lumalaki yung tiyan. So while you're treating, you wanna measure the belly just to see kapag, lumiliit na ba, nag-normalize na ba yung tiyan. It would actually help. Other things to record, weight changes, yung temperature, just to make sure na, like yung pabalik-balik na fever, your recurring fever does not come back. Or anything out of the ordinary, actually, especially for, let's say, neuro cases. it might help to write down the behaviors. Kasi if you mention that, so that you can mention that to your vet or to your admin too, so that we know how to help you. Okay, and last but not the and most importantly actually is do not stop GS until you have final blood work results. Now, standard protocol is 84 days or 12 weeks. And the reason why this is there is because based on the clinical studies conducted a few years ago on GS, 12 weeks is the recommended duration kasi it has the smallest rate of relapse. So they actually tried 4 weeks injection, 8 weeks, 10 weeks. Yung 12 weeks yung actually pinaka-lowest rate of relapse. So that's why kaya nandyan yung 84 days. That's the reason why it's 84 days. Okay, but this is on a case-to-case basis. It really would depend then on your cat. Some cats would respond a little bit slower. Some cat might be faster. So depende talaga yan. But most importantly, please do not stop the GS until you have final blood work results. In my case kasi with Kuwi, I opted to, magaling na siya actually on day 84. I was so happy. I was like, wow, 84. But her globulin levels was actually still borderline. Kumbaga within normal limits na siya pero borderlines. Kumbaga yung maximum normal. I opted to extend for a couple more weeks. Si Daisy then actually because si Daisy it was her eye. So yung by day 84 magaling na siya, maganda yung blood work niya, but the eye still had like some sort of cloudiness to it. And I was actually emailing Dr. Pedersen about this. My admin in FIP Warriors US kasi advised na please do contact Dr. Pedersen na kasi they couldn't figure out if this was a scar or if it was still an ocular symptom. So there I was advised actually to continue for a month, but I had to stop by week 3 kasi ayaw na talaga ni Daisy. Like I said, I do understand when furparents say ang hirap mag-inject because it really is, and cats will be cats. They will not, let you inject them voluntarily. So talaga may struggle na yun. But by week 3, napansin din nila na medyo okay na yung the eye, and then the blood work was also okay. So we were given the go signal to stop. Now I have also a lot of furparents asking me this, which is how to protect your other cats. Let's say if you live in a multi-cat household, you have one FIP cat, and then you have another cat in the FIP. Okay, wait, hold on, pause. I need to pause. That's Daisy actually. Hold on, please. Sorry, gusto niya sumama. This is Daisy, ang aking makulit na anak. So there. Say hi, Daisy. We're talking about you. Okay. So protecting your other cats. So like Doc Carl said, FIP is a mutation. Hindi siya nakakahawa per se, but feline coronavirus is extremely nakakahawa. So the one thing that I always tell my parents is, or at least my FIP parents, is bleach your environment and litter boxes. So bleach does work. There's no need to isolate the FIP cat actually, lalo na kung let's say na-expose naman na lahat ng ibang cats. Let's say before the diagnosis, lahat sila, they were sharing litter boxes. So most likely your other cats are also FCOV positive. And there's really no need to isolate your FIP cat kasi may stress lang to. Syempre, your cat goes home tapos hindi niya makakasama yung mga cat friends niya or cat siblings niya, may stress lang siya. So there's really no need to isolate. But and FIP is cat to cat basis. So let's say for example, even if a cat is FCOV positive, it doesn't necessarily mean magiging FIP siya. It would depend on whether or not the cat has a gene. Parang that's what the studies state, at least, that there's a theory that there is a gene in cats that allows for the mutation to happen. So if a cat doesn't have that gene, FCOV will most likely not be able to mutate into FIP in the cat's body. So here's what we should do is to bleach your environment and the litter boxes regularly. Kasi ang mangyayari dyan is FCOV is shed through poo-poo, through feces, no? So while it's shedding, bumababa yung viral load inside the cat's body. So parang ganyan lang yan. So habang pumupupo siya, bumababa yung viral load niya, the virus is released into the environment. Tayo naman, we bleach. We bleach. Para hindi na sila mahawa ulit. Para they cannot, that it won't form a cycle. They poo, we clean, we bleach. Okay. Give immune boosters. So this would help your cats. And also probiotics. The probiotics, because as Doc Carl says, it's FECV, so enteric, so nasa chan. So given that, probiotics would make sense actually. Parang healthy chan, healthy chan would always benefit the cat. So these are some of the things that you can do. Yun, the bleach. Most importantly actually is, so let's say your FIP cat is treating, tapos yung isa, hindi naman nag-mutate. But it would be very, very important that before your FIP treating cat finishes the treatment, si other cat na wala namang FIP, have them tested for feline coronavirus. Kasi what we're trying to do here is, by that time sana na matatapos na si cat 1, si cat 2 sana mag-negative na. Because what we're trying to avoid is, baka kung si cat 2 is still FCOV positive and magpupo uli siya ng poop na may FCOV, and then mahawa uli si cat 1 while off medicine, baka ma-reinfect uli. And if reinfection happens, mutation is always again possible. So yun yung trinatry natin iwasan. And one thing too that I always tell for parents is, please, please, please do read. Do read up. I know it's nakakatamad sometimes. I know baka mahirapan kasi nosebleed naman talaga medical text, especially for us, for parents na walang medical background. But we can always reach out to our vets naman to clarify if we don't understand. And it would actually make it easier for everyone around. Kasi tayo yung mostly kasama ng cats, di ba? So tayo yung nakaka-observe, we see every little symptom, tayo yung nakakaalam eh. So once we have a better understanding of FIP, it would make it easier for us to reach out, Doc, ganito nangyari. What should I do? Or admin, please help me out. What is happening? Should I see a doctor? Okay lang pa to? Is this normal? At least it would be easier for everyone around.
So thank you very much po, no, Ms. Lim. We can very clearly see how dedicated you are to the FIP fight. Now we'd like to proceed for Q&A portion. These are some additional questions submitted by some of our supporters and a couple from Ate Rosie and I as well. We had a lot more questions po actually originally, but you both are incredible and nasagot na po most of them. So anyway, first question po, no. So na-discuss na po no ni Miss Kelly, but what are some more preventive measures to ensure that your cat will not have FIP? Maybe some from Doc po siguro, or kung may idadagdag pa po si Ma'am Kelly.
I will leave that to Doc Carlos. Hi, Doc.
Hi, ma'am. Hello po. Yeah. So for the question to how to prevent po. So as I said, or as we said earlier, FIP came from FCOV. So preventing FCOV to be transmitted to your cats will also prevent for your cat to have FIP. So basically, hygiene, cleanliness, immune boosters, regular vet checkups will prevent your cat from having FIP. But remember, not all cats will have FIP. If they don't carry the gene, FIP will be impossible to mutate. Okay? Hindi lahat ng cat may gene na nag-mutate into FIP, so don't worry too much.
Na-mention po kanina na magandang idea na magbigay ng probiotics po, diba, to help prevent this. No? Regarding that then po, are there any recommendations in terms of nutrition, both for preventing FIP and in treatment?
Oh, so for nutrition, so yes, so we should always priority the nutrition, as well as giving daily probiotics can help enhance the gastrointestinal function of your cats. FECV or feline enteric coronavirus, ito po yung nag-mutate to FIP. So kapag hindi natin siya binigyan ng chance na mag-mutate or mag-replicate inside the tiyan, pag malakas ang immune system ng tiyan po, mapaprevent or mababawasan natin yung risk ng mutation. So feed your cats yung mga important nutritional needs like quality food, as well as plenty of water, vitamins, and supplements, and your cat will be okay.
Si Doc Carlos actually nag-advise sa amin ito, but it's really important to have quality food. I know some for parents would rather say na, oh sige, mas gusto ko tong food na to kasi mas mura, but in the long run kasi what you save in food, baka naman kasi maging vet bills. So you might as well get, like quality food to make sure that your cat will not get sick. Mas okay na yun kaysa having your cat keep getting sick and then you have to spend so much din, diba? Talagang regular checkup and quality food.
So na-mention po ni Doc no na FIP is mutated FCOV, right? So could you reiterate po why this virus mutates in some cats but not in others?
So, as we mentioned, not all cats carry the genes na the FCOV can mutate po. Most of our cats, or actually almost lahat ng cats, pwede pong magkaroon ng FCOV kasi it's a very common virus. But not all cats will mutate into FIP. So it's just like that po.
From Ate Rosie naman po ata itong question na to, no? I'm pretty sure. How would you protect your FIP infected cat from having a relapse of symptoms?
Okay, so to prevent relapse or para maiwasan the relapse po is usually, syempre, dapat nagsimula po tayo ng right. Dapat we should started the treatment right. So, kailangan lahat ng protocol pina-follow po natin after the treatment ng 84 days or the 12 weeks po. We should strictly follow the observation period for another 3 months. Usually, nagkakaroon po ng regular blood tests para if ever magkaroon ng problem, nare-resolve na right away. If those things ay magagawa po natin, the proper treatment protocol, the observation period, boosting your cat's immune system, giving proper nutrition, disinfecting and preventing na ang FCOV ay ma-infect po ulit siya or reinfection. Pag na-prevent natin yung reinfection, eventually relapse will be also prevented po.
Something from me naman po, no? Paano kung hindi mo makontrol yung environment ng cat? Say, kasi we had a community cat po that showed signs of FIP. So ano pong advice niyo for something like that?
Yung mga FIP positive patients po, usually they don't require na i-isolate po sila. And also, FIP naman po is not contagious. So, tuwing kailan po recommended ina-isolate po yung cat. So, usually ina-advise ko always, ina-isolate po natin yung FIP patient natin not because dahil nakakahawa siya or makakahawa siya ng FIP, but because ina-isolate natin siya para hindi po siya mahawa ng iba pang mga sakit. Okay, so protection po ng FIP positive rather than protection ng mga cats around po sa kanya.
Right, I see.
Yes.
Can we discuss po ba yung acquisition ng GS Meds? Ano pong nangyayari with that? Ba't siya mahal? Ba't siya black market?
Ma'am Kelly will answer that.
Actually, the acquisition actually is kind of, I'm not sure if we should discuss that publicly. Doc Carlos, what do you think? Parang hindi, no? Parang
Yes, but I
Yes,
understand
hindi.
the man.
Yes, opo.
As for the question why FIP treatment is so very expensive, kasi unregulated siya. So, like in human drugs, when you have like supplements that hindi nakasulat doon disclaimer, not FDA approved. Parang ganun siya. So it's not FDA approved yet. Yes, we do have GS floating around, maraming different brands. Like I mentioned kanina, none of these can be considered as official because yun na nga, they are still considered black market experimental drugs. Hindi siya official. Having said that, since unregulated siya, so there's no organization or body that's actually regulating the prices as well. So makikita mo some are selling for as low as $10, tapos yung mga iba naman umaabot ng 300 something dollars. So ganun kalaki yung price difference niya. So there's a big risk there kasi hindi mo alam eh. You actually don't know what's going into that vial. Hindi mo alam kung ano yung formulation. Kasi again, walang nagre-regulate. Walang FDA na nagre-regulate, walang Bureau of Drug and whatever that's regulating the the contents. So hindi mo alam actually na binebenta na pala saline water lang pala. You don't know that. You actually do not know that kasi walang nag-regulate. That's actually one of the reasons why there are groups like, like the FIP warriors. They also do this actually in the States and everywhere else. Kumbaga parang sila na yung naging tried and tested. Kumbaga they would test cats. Let's say for example, may furparent. So there are certain brands that work with us na tried and tested na so that the parent won't have to go through the risk na okay ba tong binili ko? Legit ba to? Parang ganun. So that's why I said, it's kind of becoming a parang watchdog. Parang naging watchdog organization. Kasi until Gilead Sciences actually releases their own GS, everything is unregulated. It's a no man's land talaga.
Is there any danger in using GS if not exactly confirmed to be FIP? Yung if for example, FCOV pa lang yung kasi na-mention niyo po kanina na some parents would like to have it be an FIP treatment kaagad, no, na hindi pa naka-confirm. So may danger po ba yun na GS yung gagamitin or anything like that?
I think si Doc Carl ang makakasagot.
Sige po. Di ba, meron po tayong protocol for FIP treatment with using of the GS. So ano po ba yung risk kapag hindi naman po talaga FIP or wala naman po talaga FIP yung cat? We are preventing po yung drug resistance. Without treatment, FIP is a serious and almost 100% mortality. That's why medyo mahigpit, or that's why very keen po dapat tayo, and we're like 90% to 100% sure po dapat tayo kapag nag-treatment is to prevent yung drug resistance. Kasi halimbawa, lahat po ng cat ng FCOV, ginagamot na natin ng GS, mataas po yung chance na yung virus po is magkaroon pa ng resistance with the GS. And kapag nangyari po yun, wala na po tayong pupuntahan. So, yun po yung isa sa mga key factors to consider. That's why, yun lang yung risk. And sa risk naman po, usually, kung tatanungin na yung side effects, usually wala naman pong based sa studies na research ko, wala naman siyang sobrang abrupt na damage with the organs and others. Usually, ang pinaka-side effect lang niya will be the GS burns na na-discuss po ni Ma'am Kelly. Yung small bumps sa skin. Yun lang po yung pinaka-makikitang side effect po ng GS treatment.
So, meron po bang parang vaccine for FCOV? Or is there any similar research na for a more permanent solution to this?
So, based po sa the veterinary practice po, we have vaccine po for FIP, but hindi po siya nag-guarantee ng effectivity po. And also, wala rin po pong vaccine for FCOV kasi this virus readily mutates. So, mahirap po and wala pa po tayong ipapasang vaccine na makakapag-prevent ng virus po na ito.
That's it for our questions po. Once again, we'd like to thank you both for sharing your expertise, experience, and time with us. Ate Rosie and I appreciate it personally, and we know that our supporters and followers will get so much from what you've shared with us today. So again, po, thank you, and we hope for the best in future FIP battles. So thank you po. Thank you very much.
Thank you so much.
Thank you, Doc Carlos.
Thank you, ma'am.
Thank you, Ma'am Kelly.
What is done in love is done well. Kasi pag ginawa mo with love, nagagawa mo ng mabuti. Please support our mini shelter.